Okay, so what does a therapy session look like? So before getting to the actual sessions, it begins with assessment, which is how we develop goals to see what we want to work towards. And this really starts by having a conversation about what an authentic voice sounds like to you, to the client. Um, from there, we'll do some self-rating scales, see how you perceive yourself, and we'll also use the VisiPitch to record your average frequency for speaking in both conversation, in single words, reading, all types of different scenarios to see what we need to work on. And from there, the video we showed at the beginning showed a little bit of what therapy might look like. Like, we'll give you voice strategies that work to alter your voice while also not straining or damaging the voice, because that can be done very easily if you're not careful, and our knowledge of the voice can really help to avoid that. So more specifics about the goals. Again, this form of therapy is incredibly client driven and individualized. Um, so we as clinicians never want to impose, make assumptions, or try to fit you into a mold about what a stereotypical male or female voice should sound like. Because gender identity and expression is a lot more complex than that. So we will work with you to develop realistic goals that help you feel like your most authentic self. So here you can see some examples of goals that were taken from real clients in a research study. Um, these include developing a voice that feels authentic, to feel more comfortable and confident with my voice, or to be gendered correctly in phone and face-to-face situations. And both of those situations are scenarios that we could assess and practice in therapy sessions. Another interesting aspect to this form of therapy is the interactions with the voice therapy with hormone therapy. So those who are on testosterone actually thickens the vocal folds, which naturally deepens the frequency of the voice. So voice therapy can really help to adjust to these changes. This can often feel very sudden for people who are taking T. Um, and you might exhibit voice cracks or breaks that you don't know how to adjust to. So we can help you feel more natural and comfortable with these changes. And for those who are on estrogen or progesterone, these actually do not change the vocal folds. So, voice therapy is the first recommended option for altering the voice for those who are on these hormones. As for the different types of therapies, we offer individual, which is just one-on-one with the client and the clinician. And it can be very personal in that way, so people may like that. We also offer telehealth, so that can be much more accessible to certain people. And we also are working to offer group therapy. This is a really great option because it provides community, as well as giving each other feedback within the session, and can be really great for facilitating certain scenarios that we want to work on in therapy.